I have a couple announcements to make before we get started with the afternoon session. Charlie Brown was supposed to start the 2 o'clock session, and you know he's challenging the ADA with a lawsuit in regards to the mercury issue, and he represents Consumers for Dental Choice Project. He will be here tonight, hopefully. That's what I'm told. And that will be at the 7 to 8:30, our usual wine and cheese cocktail reception, which will be in the Trade Winds room, which is on this floor, and I think it's over on the west side of this floor. Trade Winds room. It won't be in here. It'll be from 7 to 8:30. It's our usual cocktail party. You'll find it very, very interesting. We can all rub elbows there and share information, which is one reason we're all together. So that's tonight from 7 to 8:30, and I ask you to bring your checkbooks. We can help Charlie with some money for the lawsuit. We've also arranged tomorrow to have a lecture from a company by the name of Xelan, for those of you who aren't familiar with it. And there's a table out back, and the company's name is Xelan, X-E-L-A-N. And for those of you who haven't done any practice management yet, I suggest that you talk to Rich Lieber. He's in the back. He's that tall, good-looking fellow over there, ex-Marine, drives motorcycles, and he'll help you. This company has been helping doctors and dentists for 25 years, and I've talked to you about this before over the last couple of years. They guarantee to save you probably $1 million in taxes over the lifetime of your practice, and that's pretty substantial. So they're going to be kind enough to buy us a lunch tomorrow, but I need a head count as to who would like to attend the luncheon sponsored by Xelan. And I know you got flyers in the mail for this, so I need, if you can raise your hands, let me know who's going to be at the luncheon. Richard, is that 4, do you think? Keep your hands up, hands up. Free lunch and a great lecture, guaranteed to save you money and not pay taxes. That be enough? Okay.
Did you send the invitation to IABDM?
They know all about us. That's this company. They cross their T's and dot their I's. One of my friends just signed up with them and just saved $16,000 in taxes by changing to a C corporation and changing things with them. Not bad for the signature. $16,000. So, and I never got a thank you for it either. I think that's all I have to say, and with that, I want to introduce our next guest. She's going to give a lecture that's going to be mind-blowing for you. You know, over the years, we talked about infections in the jaw and things like that, and we started getting to the mercury issue between myself and Dietrich, and now we're going to combine both of those. I'm going to introduce our next guest speaker, Dr. Joanne Whitaker. I had known about her for several years. I met her at the Lymes Conference in Princeton, New Jersey last November. And we shared several glasses of wine together, and she said, well, what do you do for a living? I said, well, I'm a physician, and I used to be a fang banger, which most of us are. But she got a joke out of that, more than I got this afternoon, so. Joanne graduated from Wake Forest Medical School back when women had a hard time getting into medical school. She told me she slept through the entire faculty. That's how she got in. I don't believe that. Now, most of us have a lot of degrees, and then once in a while, I take mine out of the box, dust the dust off, and say, you did pretty good. Joanne has a residency in pediatrics, a residency in hematology oncology, and a residency in psychiatry, back when there was no Prozac. And psychiatry was a lot harder back then because of no Prozac. She also has her boards in nutrition. Joanne went to Thailand and Vietnam back when we had our Vietnam crisis, spent 7 years in Thailand and had an orphanage where you took care of sick kids, right? Injured kids, sick kids, malnourished kids. And then did the same thing in Vietnam 3 years later, for 3 years. An incredible lady, also probably has the skill to be a golf pro. And here she is as a physician. Now I want to tell you, she's going to show you some stuff on Lyme disease that's going to blow your mind. And she's been challenged by the government because this is very politically incorrect. So those of us who have been challenged by it, the boards or the government or whatever, will know her situation well. I encourage you to listen very closely to this. And I introduce Dr. Joanne Whitaker. Would you please come up?
back in the saddle again.
I bet you probably would have been a fighter pilot if they let you through school, huh?
Yeah, right.
Here's a microphone, okay? This is going to be for the taping session. And for the benefit of everybody in the room, you need to speak right into this, okay?
Okay.
Do you have your trigger for that thing? Oh, you're all set.
Hi, can you hear me? Music goes along with it. Can you turn that down a little bit, please? Well, I think this is a first for me. I've given lectures all over the world to many different people, but I don't think I've ever talked to a group of dentists. But since I know you're fang bangers, I know we're going to have a good time. I wouldn't be here if it weren't for Chris, and I think we're going to have the music the rest of the time. I appreciate being asked to come here, and I think that what I like about it the best is that most of my medical friends who actually know me fairly well and know I'm a well-trained physician, for sure this time they think I've really lost it. So I'm glad to talk with a group of dentists and whomever else you might be. And I want to talk really about 4 things I want to say. I hadn't really decided what I'm going to say because I think I've worked harder on this talk than any other talk I've ever given, because I'm trying to weave a whole bunch of things in so that it'll make some sense to you, and also it will stir you up to maybe help us get everybody to understand that this Borrelia burgdorferi, a cell wall deficient organism, is very important and very much with us. So the title of this talk, I'm sure you all can read, so we're not going to go through each little word. This is going to be a very right-brain Charlie Brown talk, and I'm sorry that he wasn't up here because I was going to follow him and I was going to have a couple good jokes, but anyway. So it's been a journey. The title is A Journal of Cell Wall Deficient Stealth Pathogens in Humans. I'm Dr. Joanne Whitaker, and my friend down there, Dr. Natty, she is going to be helping me at the end because we are going to do some BOWEN techniques on different people.
It's scratching, actually. Maybe I'll just put it here.
Okay. Next slide, please. Now, my objectives are 4. Number 1, we're going to take you on this journey of this cell wall deficient organism. And number 2, I'm going to tell you about my passion for a technique that I've learned called the BOWEN technique. And the reason for bringing the BOWEN technique in is because it affects cell wall deficient organisms, and that's how I got started in all this. Number 3, I'm going to try and really interest you in the autonomic nervous system. When I was in medical school, I don't think I learned anything about the autonomic nervous system, but I certainly learned a lot about it in recent years, but it is vital. And number 4, what we're going to do actually is we're going to do some demonstrations on anybody that might like to taste the BOWEN technique. Because unless you experience the BOWEN technique, you really don't know anything about it. So these are my 4 objectives. Next slide, please. Now this is a culture, actually a 6-day-old culture, stained with carbofucin. It's a tissue, it's actually bugs growing within these cells, and these bugs or cell wall deficient Borrelia burgdorferi. This was done by Dr. Lida Matman, and if you people don't know who Dr. Lida Matman is, you're in store for something wonderful, because she's one of the smartest women I've ever had any contact with. She's a great friend of Chris's and a lot of other people here, but she has her third edition of her book, and it's called Stealth Pathogens. And if you know what stealth means, it doesn't nearly to describe this organism. Now, this journey with me started in a small laboratory in Florida. And actually, I was doing research with the BOWEN technique, and I was trying to show why the BOWEN technique works on bunions as well as getting people off the heart transplant list. And I thought, well, what in the body in the world could do all these different things with such a little bit of thing of the BOWEN technique? And I thought, well, the only thing I know that really affects the body that much is the autonomic nervous system. So I started doing research with the BOWEN technique, trying to show that it affected the autonomic nervous system. Well, what happened was I happened to be working with a rheumatology group, and so I was seeing a lot of fibromyalgia patients. At that time, I'd never heard of fibromyalgia, much less be able to spell it. But anyway, I started working with the fibromyalgia group, and we showed that it definitely does affect the autonomic nervous system. Well, while we were doing the study, we found that sometimes in these patients, what happened, either sometimes immediately, sometimes 24 hours, sometimes 48 hours after doing the BOWEN technique, they developed flu-like symptoms. They didn't last too long, but definitely they had flu-like symptoms. And so I asked all my BOWEN practitioners that I knew, I said, what is this? Do you get flu-like symptoms after you do the BOWEN technique? Oh yes, that's not unusual. I said, well, what causes? They all said, oh, that's toxins. Well, I thought about that. Yes, toxins, that's a nice, easy answer. But I wasn't satisfied with that. So I thought, I think it's some type of infectious disease. Most of my research actually had been done in infectious diseases, and actually with the fluorescent antibody technique. To show you how ancient I am, I'll tell you, in 1954, in Detroit, Michigan, I did the first clinical study with the rapid identification of pathogenic E. coli, because all the babies were dying in the nursery. I was also at that time, that's when I was putting the babies out in the sunlight to cure the erythroblastosis, the increased bilirubin. But we were also working with blood antigens. So I'd worked with throat cultures, with all kinds of different things with the fluorescent antibody technique. So anyway, I thought, I think this is an infectious disease. So we started trying to find out a little bit about cell wall deficient bacteria. I knew this wasn't an ordinary infection. This had to be something different. So somebody said, oh, well, there's a purple book about it, a purple book. So I started looking for this purple book that was written by Lida Matman. I finally found the purple book. I went to Detroit, met Dr. Matman, and asked her if she would help me with this research study. And we started. So we did 25 patients with fibromyalgia. Every single one of them turned out to have Borrelia burgdorferi, the causative agent of Lyme disease. So it wasn't just a toxin. They may produce toxins, but there were bugs there too producing those toxins. So then I found out that there weren't any good tests for Lyme disease for identifying BB. We'll call it BB from now on, because it really shoots good. So anyway, we started out to develop a test, a rapid test to identify BB. So, of course, when you're doing research, your blood's always the first one that they draw. So they drew my blood, and it was positive culture. Lida got a positive culture. And our first test that we did with our rapid test was positive. I said, I don't have Lyme disease. And so anyway, we sent off my blood for all the other tests, which weren't usually positive. They were positive, including a LUAT test over 400, which the government, as somebody says, isn't any good, but I don't believe that. So anyway, we started doing this test, and we've been doing it for a period of time. Next slide, please. And it's a very simple test, which we do. We just simply look for the organisms. You know, it's like tuberculosis. How do you make a diagnosis of tuberculosis? You see it. This is the way we make the diagnosis of Borrelia burgdorferi. We do it with EDTA whole blood, and we use a specific antibody that's been tagged with fluorescein isothiocyanate, and that's the way we look for the bug. And then we just simply make a slide. We look at it with a very fancy microscope, which costs a lot of money, but it works, and so we see the bugs. Next slide, please. Now, I wouldn't say I've been ill, but I hadn't been too well, at least for 6 or 7 years, and had been given many rheumatological diagnoses. The last one was polymyositis rheumatica. So anyway, about that time I was having pain everywhere, but also I was having pain in my tooth. So I had an x-ray and also found out that I had had a root canal in that tooth. And what the x-ray shows is what you can see here. And the next slide, I don't know whether it's going to show you dentistry anything. I couldn't tell much about it. But anyway, supposedly what it showed was at the end of the root canal, there was a small radiolucency. So definitely I had something going on in my tooth in 1994. So I didn't do anything about it. Next slide, please. And so, as I told you, we went ahead and developed this fluorescent rapid test to identify BB, and we call it the rib test. So what we do is we just make this slide, and then when we see green, which is about 550 mu, and the reason they use green is because that's the most sensitive color for our eye to see. So we can see this green fluorescence, and we do see the green fluorescence. We know that the BB bug is there. We then can look in phase, and I don't know whether you can see it or not, but if you look in this L body is what we call these round bodies, and it actually is an L body because it was first, they first described it in the Lister Institute. So when you look in phase, you can actually see sometimes that these spirochetes are inside this L body, and you can see it. Probably you can't see it there, but we can see it in the phase microscope. And in this blood, we rarely ever see the classical spirochetes. This was in one blood, but this is very unusual. What we see are usually the L bodies. Next slide, please. We also look at it in dark field, and many people, I'm sure you can see these inclusions in these red blood cells. Next slide, please. Now, I used to be a pediatric hematologist oncologist, and of course, knowing a little bit about blood, I started looking very carefully at the peripheral blood smears. And we found out that these patients who had positive line cultures, every single one of them had an abnormal blood smear. So the people can say, you know, you can't, this is a false positive and all this, but the point is, if it is a false positive, they all have abnormal peripheral blood smears. And they're very abnormal. They're not a little bit abnormal, they're very abnormal. And it's, I did a lot of work with lead poisoning, and it's very similar to what we used to see with the children with lead poisoning. And they have hypochromia, not as much hemoglobin in the red blood cells, but they have hypochromia not because iron deficiency, they have hypochromia because something interferes with the incorporation of the iron into the protoporphyrin. And if you can see, I don't know whether you can see, but you can see blue cells in there, and that means that the bone marrow is really revving up, and they have a shortened lifespan of their red blood cells. Next slide, please. Looking at the blood smears very carefully now in these patients with who do have a positive rib test, we are now seeing many people with a parasite, Babesia, which are probably what those inclusions were in the dark field. But you can see the Babesia, they're classical, different. They're chromatin dots, they're ring formations, they're all kinds of different things. And being in Southeast Asia, I saw a lot of malaria. This is very different from malaria, but people that didn't know what they were looking for might think that this was malaria. But these are classical Babesia in this lower slide. In addition to that, there is another bacteria, Ehrlichia, and this is very devastating in children. And both of these organisms are very devastating. And the Ehrlichia actually, they're in the granulocytes and also the monocytes. If they're in the granulocytes, it's called human granulocytic Ehrlichia, and if it's in the monocytes, it's called human monocytic Ehrlichia. So what you have here is you have three organisms, and actually all these live in ticks. And what I think is happening is that this Borrelia bug is so smart. It doesn't kill you, but it makes you so sick you want to die, and many people, you heard somebody say that somebody had committed suicide. Many people would rather die than have to go through what they do with this disease. I have it, I know. Next slide, please. So Lyda Matman and I, we decided that after I developed this test that we should do we needed a way to confirm that this test was real. So what we did over 300 different same draw specimens. She cultured it, and we did our rapid test. We all got a 100% confirmation of over 300 specimens that were positive for Borrelia, burgdorferi. In addition, next slide please. We have seen it in all these states. This doesn't represent the number, this just represents the states. And I think the reason we hadn't seen it in the other states is because they don't know to send the blood to us. Next slide, please. We've also seen it in Brazil, Denmark, England, many different places around the world. Next slide. We found it in the well water in St. Thomas, and we also found it in the African dust from Africa. So it's everywhere. It's not just a tick-borne infection. Next slide, please. Now, this happens to be my tooth at the top there, but we've seen it in teeth, And if you look, you can see on the left is the rib test, the fluorescent test, and on the right is the phase. We've seen it in breast milk. Dr. Mattman has seen it in semen. We don't have any pictures, but we've seen it in semen. Dr. Jones, who we've seen over 300 children now, very, very sick children with this disease. He has over 30 cases of congenital Borrelia burgdorferi. This is a devastating, awful disease. We've seen it in foot nodules. Now, all of these people that we have seen, actually, most of the diagnoses are fibromyalgia, or all the algias, all the different rheumatological labels. Next slide. Shoulder fluid, lots of spinal fluid, it's there. Next slide. Now this is my eye fluid up here. Finger joint fluid and tonsils. I thought that was an interesting testimony about the lady that couldn't sing. We've seen it in tonsils. It was loaded in the tonsils and adenoids. Next slide, please. Now, this is interesting. The vectors that we've seen it in, we have more than that now. But we've seen it in Florida and California mosquitoes, ticks, of course. And if you look at the tick, actually that green that you see around there, that's actually the mouthpiece of the tick. Now they say that they have to regurgitate it from their stomach, but it must stick right on their mouthpiece, so when they bite you, they're ready to inject you. And this is in the African dust that I talked about. Next slide, please. Now, I don't know what this shows or not, if it shows anything, but this was my x-ray in 1994, and some of the dental experts can read it, but supposedly there was a small radiolucency in the bottom of the root canal. Next slide, please. And this was the x-ray in 94. Can you see anything?
99. That's 99.
Yeah, 99, yeah. But 99, this was when I had it removed. But supposedly it had gone all the way up to the apex of the tooth. Next slide, please. So, next slide, please. So this is before and after. Now, someone just showed me a while ago that some dentist was putting fancy teeth over the top of something. Anyway, point was that I talked with my dentist about this, and he wanted to put a fancy tooth in for me, an implant or something. I said, no, I want it wide open. I don't want anything in there. I know that this has bugs in it, and I want it to be wide open. I don't want any fancy thing covering it over. Next slide, please. So what we did, we took my tooth and we washed it out very carefully. I also asked him to wash out the socket very carefully. Get a sterile swab, take some from the socket, also took the tooth, soaked it in saline, and then we looked at it with our rib test. And as you can see, there's a brightly fluorescing L body that came from the tooth that you saw the x-rays of. You can also see, I think, something that looks like a spirochete coming out of the top of the tooth. And if you look carefully in the next, phase, you can see more definitive structures. Next slide, please. I'm sure all of you know that there is a spirochete in our saliva. What it does there, I don't know, but anyway. I wanted to be sure that what we were seeing with our fluorescence from my tooth did not come from Treponema bacentii, I think it's called. So we did saliva, and we found that's a phase on the left actually, and the fluorescence on the right. We found definitely that there were L bodies in the saliva. Next slide, please. When we looked in this is just a right heme system of the saliva, we saw a good many classical spirochetes, but when we looked to see if the spirochetes were fluorescing, they do not fluoresce. So we weren't having a cross reaction from this treponema spirochete. Next slide, please. Okay. So that was the first objective, to tell you about the journey. Maybe I'll say a little bit more about tiny bit about the journey. The journey has taken me many different places, and I've talked with many different people. And the thing is that we cannot understand why we're getting so many positive cultures. We're getting nearly every culture we do is positive. But remember, all of these are very sick people. When we try to get a bunch of normal controls, we then find out that they're positive, but if we take the histories on them, they have very good reason to have Lyme disease. Dr. Mattman, when she did her first study on chronic Lyme disease, she was able to get 23 out of 26 negative controls. That was 5 years ago. Now she is getting only positive Borrelia burgdorferi specimens now, the same way I am. Now this is the question. Why is this so? Well, I think it's so because, for one reason, I think that any blood-sucking insect that has a low enough body temperature now carries Borrelia. The other thing I think is that these two other, in quotes, tick-borne infections, Babesia and Ehrlichia, I think that their plasmids, these bugs are smart enough to know we better jump on BB, because BB is smart enough not to kill the host, and if the host dies, we don't have any home. So I think that it's a new type organism, and I think this is what's going to come to be the new emerging infection, the plasmids that have jumped on the BB. Now, the BOWEN technique. I've done a lot of things in medicine, but also I've had a lot of fun in life. And one of the things that I love to do is I've been very interested in how the dolphins heal. And I've swum with the dolphins all over the world. But most of the time I go to swim with the dolphins in Hawaii, in Kona, Hawaii. And I don't know how many of you are old enough to remember this, but there's a song, The Little Grass Shack in Hawaii. Well, when I was a little girl, my mother used to play the ukulele and sing this song to me. I'm getting a little teary. So I went to, I was studying Healing with Love, I think it was, by Leonard Laskow. And I went to Hawaii to take his course. Well, one of the things was we swam with the dolphins. And I just fell in love with the dolphins because they're civil, you know, they're nice to people, they play together, they have fun. So I've been swimming with them for the last 10 years. But during the first time that I went there, someone did a BOWEN on me, a BOWEN. And so I was so impressed with that, I went to Australia to learn the BOWEN technique to cure my rheumatological diseases. But the dolphins, as you know, they heal through sound. And I now have found out, and we'll go on to show you a little bit why, I think the BOWEN technique works the way the dolphins do. They heal through harmonic vibration, through sound. But these animals are so graceful and they're so wonderful. I invite you to get the passion that I have for swimming with the dolphins, because they will teach you a lot. Next slide, please. The BOWEN technique, I liken it to playing a string instrument. Now, I don't know how many of you have ever tried to play a string instrument, or maybe hear somebody try to practice on a string instrument that didn't know how to play. But in order to get beautiful music or beautiful sound, what you must do is you must be in the right spot, you must have the right tension, and then you must strum in a way to create this beautiful music. Now, we do the same thing with the BOWEN technique on the body. I think the body is like a fine Stradivarius violin. And what we do is we just pull the skin away very gently and then roll over. And what we're doing is we're making a specific frequency which goes to the autonomic nervous system and balances it. It's very simple. It can be done on children. The hyperactive children just love it. Pregnant women think it's marvelous. Instead of going to the physician and they say, oh, you'll get over that sciatica when the baby is delivered. You can do 2 or 3 little moves and boom, pain's gone. Next slide, please. Now, the reason the BOWEN technique works on bunions and gets people off the heart transplant list is because the autonomic nervous system, as I said before, controls most everything in our body. 85 to 95% of all our body is controlled by the autonomic nervous system. So it makes sense that if you balance the autonomic nervous system, you're going to heal and help people regardless of whatever they come and say are their problems. Next slide, please. We know very well that the autonomic nervous system balances our cardiac activity. And actually, there are 2 branches of the autonomic nervous system: the sympathetic, which speeds the heart up, and the parasympathetic, which slows it down. Now, everybody believes that, but even the cardiologists still aren't using such things as heart rate variability, which is much better than a single lead EKG, but we'll talk about that too. Next slide, please. Now, many people talked about facial neuralgia or trigeminal neuralgia or whatever you want to talk about it. Now, the BOWEN technique, there are 4 little moves. And this is actually was a 68-year-old man who came to me. He'd had severe pain for 2 years. He was a retired dentist. He'd tried all those things. He'd had teeth pulled. He'd had nerves cut. He'd had everything. And he was on, I think, 600 milligrams of Tegretol. It's awful. So anyway, we did 2 BOWEN, plus he's very skeptical, the whole thing. But anyway, we did first BOWEN. He said, oh, nothing, didn't feel any differently. We have a video of him too, but you could tell that he'd had a little something go on. Did another one on him. He was convinced something was going on. I think I did 1 more treatment on him. He hadn't had any pain since then. So we have dentists come take our course and they say, why in the world did we have to learn all this to learn these 4 little moves? And I say, because you're balancing the autonomic nervous system. Next slide, please. So heart rate variability. As I said, it's it's a single lead EKG, and all we're doing is we're measuring the variance of the beat to beat of the heart rate, because we said the sympathetic speeds it up, parasympathetic slows it down. So what we're doing is a computerized program. You get a printout, and we just take the highest spike, the R wave, and we measure the variance in the beat to beat. Next slide, please. This is a normal pattern that you would see. The high spike is a sympathetic, and the small spike is the parasympathetic. Next slide. Now, the pattern on the far right is increased sympathetic. Now, this man came in, he had had a boating accident 6 months before he came into me. The usual diagnosis these days, I think, is rotator cuff injury, and he was supposed to have an operation. He didn't have an operation. He was a big-time developer in Canada, and here he came into me holding his arms in tears. This was his pattern. He had a very abnormal heart rate variability. So we did one BOWEN treatment on him, boom, his arm was fine, but he still had a very abnormal HRV. So we did, I think, 2 more BOWENs on him, and he hadn't worked in 6 months, and he went back to Canada. He's a big developer, having big-time stress again. The one on the right actually was a friend of mine. She had narcolepsy. She has increased parasympathetic. And you'd be talking with her, and she would go to sleep while you were talking with her. She had 1 BOWEN treatment, and a man happened to be there talking on HRV, and she listened to 1 whole hour lecture on heart rate variability, which she had no background in or really no interest, but at least she didn't go to sleep. Next slide, please. This just shows 20 patients with fibromyalgia. They usually come in and they have very low total power, or chi, or whatever you want to call it. And we showed that usually what happens after the BOWEN technique, it doubles or triples your total power. Next slide, please. Also, the patients that come in with fibromyalgia, you can see she has a high peak over there, high sympathetic, but she has no parasympathetic. And these patients, not only with having severe pain all over and many other symptoms, they have very poor sleep patterns. And you see she has no parasympathetic. So we do the BOWEN on them. Now these are patients we usually have to see several times and maybe for a month or so, because they really have a chronic disease that needs to be helped. But remember, every single patient, every single fibromyalgia patient that we have seen has cultured out and had a positive rib test for Borrelia burgdorferi. They have Lyme disease. Also the chronic fatigue syndrome too, for the few that we've examined. So after we do the BOWEN on these fibromyalgia or Lyme patients, what happens is their parasympathetic comes back. When their parasympathetic comes back, their sleep problems go away and they feel much better. Next slide, please. Now this is just to show you that, I've forgotten who said it, but the important thing is that the people in this room need to communicate with people. Everybody needs to communicate people and about the things that are important to help people. And this is true in our body too. The central nervous system, probably the most important part in our body, but must communicate with the autonomic nervous system and also for our motor skills. Now we made this slide really because I just gave a talk at Arizona State University. Actually, Dr. Natty and I just gave a talk there to the golf of the future. Now these were people who were the most well-known educators in golf. And we were asked to give this talk The title of our talk was Breaking Records in Golf by Balancing the Autonomic Nervous System with the BOWEN technique. So, as you see, the BOWEN technique is a very important thing. Next slide, please. So the autonomic nervous system, as we said before, has two branches, sympathetic and the parasympathetic. The important thing about the sympathetic is that it excites us to get ready to do something, but it also can throw us into panic and fear. Whereas the parasympathetic, relaxation, restoration, and sleep. So I can't talk enough and emphasize enough, the parasympathetic and the sympathetic nervous system are vitally important to us, especially if we want to have peak performances. Now I'm working with one golfer. He's a 38-year-old man who's decided that he's always, all his life, he's wanted to play on the PGA Tour. And so what he's doing, he quit his job. He now is working to get on the PGA Tour. We're giving him the BOWEN twice a week, and what is happening with him is that his HRV, his heart rate variability, is now, he's increased his total power so much that I talked with Dr. Rifkin, who has an HRV booth out there, told me that he'd only seen one other person with as high total power as this young man has. But the important thing is he has a very high sympathetic and a very high parasympathetic. And so what that means is he's balanced and he's ready for action. So that's what we need to do. We better get ready for action, and we better try and get everybody to understand that this cell wall deficient bug is very, very important. When we talk about cell wall deficient organisms, we have to realize that what this means when they don't have a cell wall is that they can go into anything. This is what Dr. Matman thinks, and I believe her. They can go from a staph to a strep or whatever, depending on the environment. So if somebody really believed this cell wall deficient stuff that we're talking about, that means that all the microbiology, all those phylums and all those things would probably have to be changed, and it would be turned upside down. If we really found out that all these rheumatological diseases is a cell wall deficient organism and could be treated by antibiotics, what do you think would happen? The rheumatologists wouldn't be too happy with me. They're not too happy with me now. So that's all the slides. I'm not sure. Next slide, please. So, the Borrelia burgdorferi, I'm going to read this. The smartest bug alive, and in time, or may already have, infect us all. The question is, it's not who has Lyme disease, it's who doesn't have Lyme disease. Thank you very much. Sure. Now, before I start answering any question, I'll tell you right now, there are a lot of things that if they answer the questions, I don't think they know the answers. They're just making it up. So I don't do that. If I don't know, I just say I don't know, but maybe blah, blah, might know, but whatever. And I can't really see you with your hand up, so just stand up and start talking, please.
I was recently my partner works on a watershed where they have a lot of tick bites, and one
I'm
of
sorry,
them-
I'm having a hard time because I'm having this music
All right,
is playing.
Is treatment for Lyme disease by intravenous antibiotics? I mean, it nearly kills somebody to do that. And the other thing is that another person that's been bitten several times by ticks has an enlarged I'm not a doctor, so I can't think of the exact artery, but it's the major artery to the heart, so they actually have had to replace that. And now what they're looking at is that is caused from this Lyme disease bug. So I'm wondering if what you see treatment for it is intravenous antibiotics, which is extremely horrible. Or are you finding treatment? Because you've given us a lot of information, but you haven't spoken about treatment to kill the bug.
Well, I think any treatment should be whole person treatment. Some of these patients that come to me have seen one man and one woman. They have seen over 100 physicians, doctors, before they came to me and got a diagnosis. It's not unusual for them to see at least 30 or 40 doctors before they have a diagnosis. The important thing is to have a way to make the diagnosis, and the tests that are done now are no good. They're usually dependent on an antibody test, and the antibodies are not made because, number one, it's a cell wall deficient organism. The other thing is, when we see them in the blood, as I said, most of them are L bodies and they go and hide. And they particularly love to eat the myelin sheaths of the nervous system. So they hide in the nervous system and in the joints and in all the other places. Now, I have had intravenous antibiotics. I had Rocephin for 6 weeks, and then after that I had another IV antibiotic for another month. But that was because I had my 4th hip surgery. So I didn't want the bugs to eat up my new hip. But I think you need to treat the whole person. Most of these people end up with psychiatrists. They're the ones, many of them, that are making the diagnosis. And I'm telling you, a lot of these people are committing suicide because they don't want to live anymore. So number one, we have to make the diagnosis as soon as possible so that we can start treatment right away. Right now, actually, I'm on immune factor, which I think is very important, and also grapefruit seed extract. I think we need to try to decide every possible way we can do whole treatment therapy, whole person treatment therapy. We need to be on good flora, good probiotics. We need to take enzymes. We need to exercise. We need to do all these different things. We need to have fun. So antibiotics is not just the treatment of choice. If you make the diagnosis soon, you don't go into the chronic Lyme disease like most people do because nobody's been able to make the diagnosis. I don't know whether I answered your question or not.
Yes, thank you.
Yes?
How do you get this test? Where do you have this test? Where can we get this green stain? Where can we get this test?
I'm going to give you out some handouts. The other thing is I have a web page. It's www.bowen.org. Any more questions? Yes.
I just have one more. What is a cell wall deficient organism? Are you saying it doesn't have a cell wall, so it goes in and hides inside other bacteria and viruses, and is that what you're saying?
Yes, that's what I'm saying. The other important thing, remember, many years ago when Fleming discovered penicillin, he said the reason it works is because it destroys the cell wall. Can you think how many millions and millions of bacteria we've made? Cell wall deficient bacteria? in the test tube, the way they make cell wall deficient organisms, they put antibiotics in it. But Dr. Mappin has shown right now that these cell wall deficient organisms can grow on top of penicillin. It could live in straight phenol. It's a very, very hardy organism and very smart. Yes?
I just want to know, what do you think the cell wall deficient bacteria? It's always a parasital form, or sometimes it might not act as a parasite?
No, it's a bacteria. It's a.
No, what I'm talking about is always acts as a parasite, or sometimes it's just neutral, it does not affect the body, or it's always a parasital.
I love that question. Are you an Enderline man? Pardon?
No, I don't think so.
Well, see, this bug is so smart. How many people know anything about the Enderline theory? Oh, wonderful. Okay, well, pleomorphism has been talked about for many years, and who knows, maybe this bug might even be maybe a good bug. I don't know, maybe it's converting into a good bug. I don't know. But the thing is, which first question that somebody should have asked me is, what are the negative controls that you do with this test? Every time we do this test, we do a positive control. We do a positive control on the bug itself to show that this works, and we do a negative control. We take an antibody that's been tagged with fluorescein isothiocyanate, and it's specific for E. coli or other organisms, and we do that every time we do a test. So we do definitely do a negative control. All of our controls have been negative. Anybody else? Yes?
What kind of problems are you having with the government?
What kind of what?
Repeat your problem again. You're afraid of the government.
Oh. Well, I've only had problems with the state. Because I was doing a research test, they told me that I could not send out anything to help for diagnosis and treatment. I could continue doing all the research I wanted to, but I couldn't send out any reports. They would let me send out actually unmarked photos. That was okay. And statistical information, but nothing else. We now have actually just 2 days or 3 days before I came here, we've been given a license, a hematological license, so that means now that at least we can send a final report out to the people. Yes.
So can you take samples now from these people?
Sure.
Give them a diagnosis if they send you blood samples?
Sure.
Okay.
But unfortunately, I have 8 people working with me now, and I take a very small salary. My golly, I wish I would make the $16,000 that the government's that somebody's gonna save me. But the highest salary I ever made in my life, and I was a full professor of pediatrics, was $35,000. So I'm not one of those rich doctors.
In your handout, do you have an address for?
So what I'm going to say is we must charge $200 right now because we haven't been able to get a grant, and the biggest donations anybody's given us, except was out of my pocket, and another friend of mine, was $5,000. So we live from payroll to payroll, paying those 8 people to do this research.
On your handout, do you have instructions on how people are to take blood and send it to
Well,
you?
what they need to do is it tells where to call, and then that you must become a research protocol doctor, and we'll fax you the questionnaires and tell you exactly what to do. And then we now can send out a preliminary report, and we'll tell you whether you have Babesia or Ehrlichia, and we check if we see fluorescing structures, but of course those don't mean anything. You understand that? I'm kidding.
Speaking of your
Yes, right. So as soon as there are no more questions, what we're gonna do, Dr. Natty and I, if you have any neck problems, back problems, TMJ problems, or shoulder problems, we can do you in the chair. We'll do a BOWEN on you in the chair. But usually what we do is that we have you lying down in a nice padded bed, and then we do specific moves for the upper back, lower back, and neck. But we can, anybody have neck problems? Anybody have back problems? All right, so what we'll do is we'll start out, we have how many chairs here? 4 chairs, bring a couple more chairs. We'll have 6 chairs. We have 1 wheelchair back there if Ed wants to come. We'll just do you in your wheelchair. And just come up, spill the chairs, we'll do you. Are there any more questions? Okay, so we'll ask the people before what their problems are, we'll do them, and then we'll let them tell you if we've done anything.
Sometimes I think there are things that we know. That's well, you see basic level of
Don't need it, don't need an otoscope, stethoscope, otoscope. The healing hands in you. You do it on 1-day-old baby or 100-year-old man or a woman in a wheelchair. Never roll it around like this. Very bad. Wear off your mobility. Okay, feel the chair. Okay? You, lower back. Okay. My friends get very upset with me when I do this in the restrooms. This is fantastic, this movie, absolutely.
Or sometimes it does. Because sometimes it means that you have positive test,
Hurt?
a regular test.
Okay, no hurt. Okay, next
So
chair.
that's why I thought so maybe certain form does not affect by nobody does not prevent there. Maybe some form of notes.
Next.
I'm not saying that.
I'm asking you, TMJ, okay, do you have any reconstruction? Good. I'm doing my own reconstruction. Okay.
Every person is sick. Everyone is sick.
Oh, wow. Yeah. Oh, wow. Sometimes we don't have too many patients come because we pick them up. They leave. That's right. She's crying. You better believe it. I see people every day like this. It's just, they say, you've given me back my life, Dr. Whitaker. Okay, let's see, all right, I'm not used to doing the behavior TMJ on sitting up patients.
We're not gonna do that.
That open postman, not too long. Now the TMJ is all it is, it's right here, I just go, I make a cross, I go doom, 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 and then I go back here, that's sore. Usually there's a little node back there. And then, that's it, 4 little moves, that's a TMJ. Just right here with the glass, that little. Right up behind the ear. Yeah, right. Yes, and animals, fantastic for animals.
What does it look like? You can't see from the back.
Well, here, I'll do it. I'm doing it. Over here, I go boop, boop, boop. You're holding it, see? Boop. And then boop. And here, that's it. 4 moves. You have to come take this course. Okay. Now,
Where do you give this course?
in Florida.
Of course, only 15 minutes. It says.
Flight is longer.
Yeah, get a better move. Can you tell me? Now, I'm starting to get
No, but I mean, 30. Yeah, no, what I'm saying, it's the volume.
How about knees?
Oh, wonderful.
How to do? Oh, you're still busy.
This is my story and I'm sticking to it.
You're not done? Oh, well, turn around and do your No, if you really need, let's go around. Yeah.